Known as live now.
Okay, James. Afternoon, everybody. Thank you very much indeed for joining this weekly Greater Manchester COVID press briefing. We've just concluded our committee meeting earlier today, and obviously want to share with you some of what was discussed. You'll see that I've escaped my prison cell with the beam across my back, so I'm in the office and very much wanting to ensure that we enter a new phase of living with COVID, and I'll come back to that theme later on in today's press briefing. So if I may firstly turn, as always, to the figures. Firstly, the figures on Greater Manchester cases. You will be familiar with these figures because obviously they are in the public domain, but there you can see the way in which things have developed over the summer. Obviously, the standout figure is Bolton, very much in the news, seen a steep surge that we couldn't honestly have predicted, and that remains an ongoing situation, and I will come back to that. But generally across the board, with the exception of Trafford, we are seeing obviously increases across Greater Manchester. So this is a challenging situation. The lead director of public health, Kate Ardern, said that the reason, in their view, is that there was a large amount of underlying virus in communities across Greater Manchester, and the effect of the summer, people being out, more socialising outside, has led to this change. And of course, the figures don't yet, in our view, fully take into account the effect of schools returning. So this is a really challenging picture. I personally believe that lockdown was lifted too early in the north of England. I'm talking about the original lockdown, of course, and I think that explains in part these figures, that we were left with a higher level of underlying virus when the lockdown was first lifted. And obviously, we, as you know from this briefing, we've never been able to get those figures down where we need them to be. So that's the figures on cases, and it reflects obviously what Public Health England have concluded, that there is a situation where the virus has become endemic in parts of Greater Manchester. Looking at the next slide, we wanted very much people to have some visibility on testing numbers in Greater Manchester, because it is the case that we are testing here at the highest levels anywhere in the country. Many of our authorities are in the top tier of authorities when it comes to testing. You will see that the Greater Manchester average on that bottom line for the week just ended, just over 1,500 tests per 100,000 population. The England average is 957. So, you know, that's a more positive story. We believe we are identifying more positive cases here because of the levels of testing that we are doing. And it's important to set alongside the first slide against this so that people can put the two together. If I may, I just want to go on to a third slide, which provides information around admissions to hospital and patients in hospital and the current situation in our care homes. Now, I think this is an important slide just to dwell on for a moment, because the worry, of course, is that as virus has begun to circulate in the community, particularly amongst younger adults, people use the phrase young people, which we think is not technically correct. The transmission that we're seeing is in people in their 20s, 30s, 40s, not necessarily young people as often as described. What the fear is, of course, is that transmission might lead to more spread amongst more vulnerable members of the community, leading to hospitalisation, and of course bringing infections back to care homes. And this is something that we are very, very vigilant about. So the figures that you've got do show something that needs to be watched very carefully. What you will see on that top line is the cumulative weekly admissions to hospital for those weeks, beginning with the 4th of August and ending with the 8th of September. And you will see that in the last week just gone, we've had a significant increase in hospital admissions, 19 extra people on the 16 that we had the week before, which suggests that we are beginning to see a rise again. The position with regard to intensive care has remained pretty stable, although you will also see a corresponding rise in the number of patients in non-ICU beds, again reflecting perhaps the increase in hospital admissions. On the bottom line there, another statistic that needs to be watched, and this is the percentage of care home residents in Greater Manchester with a confirmed diagnosis of COVID-19. And though the numbers are very small, and it's very, very important to stress that, and this is only a 1-week change, nevertheless, there has been a change. And again, that's something that we discussed this morning. What we want to achieve, of course, is maximum protection for the most vulnerable members of our communities, learning the lessons of what happened earlier this year. And leaders and districts are talking about a form of local shielding. So perhaps not the full national shielding programme we saw earlier this year, but certainly a discussion is now underway about whether we can have a shielding programme in Greater Manchester that affords greater protection to members of our community who are most at risk. And we believe as we go into the autumn and winter, this is something that will be needed, is the right thing to do, and we'll be looking to the government to support us in that, in providing the necessary resources. Just a final point on the statistics before I move on to some more general comments. Obviously, this is a difficult position for Greater Manchester at the moment. And the message I would have to all of our residents is, if we don't, all of us, observe the rules closely, we are going to see the numbers entering hospital increasing. We run the risk of seeing the number of residents of care homes becoming infected. You know, that's what this is about. It's not a kind of a lecture to people for the sake of it. It's about not allowing a situation to develop that perhaps is already happening in other countries, France and Spain, where we allow this virus to once again attack care homes and put the more vulnerable members of our communities at risk. And I would ask everyone in Greater Manchester to look at those figures, think about the lives involved, and obviously, as difficult as it is, observe the regulations and the guidance closely. Washing of hands remains the most important thing people can do, sanitising, always keeping safe distancing when out and about, wearing a face covering. We've got to get better at living with COVID, and that is the only way, I think, that we can minimise the risks of seeing greater hospitalisation and sadly worse loss of life. It's that serious. Moving on, if I may, to some of the broader issues to touch on today. I just want to say at the beginning, by way of introduction, that of course, you know, as a former health secretary myself, I recognise how challenging this is for the current health secretary and indeed for the government as a whole. They've got a very, very difficult job to do. However, I can only speak from experience in saying it's got more difficult to deal with the government in recent times. It was difficult, and it's got even more so, particularly in the way announcements are being handled. If I look back at the last week, we've got 3 examples here that I think have not been easy to deal with. A week ago today, we had the situation with Bolton and Trafford, where there was confusion about whether or not they were out of regulations, and obviously that was an avoidable situation, but it nevertheless caused confusion. If we come to this week and the announcement that was made yesterday about Bolton, and the closure of hospitality. That was not a decision in which I or the other leaders, bar the leader of Bolton, had any involvement in. We absolutely understand that it was a fast-moving situation, but nevertheless, obviously, an announcement was made yesterday lunchtime that took many of us by surprise. And then late last night, under a 10:30 embargo, which I don't understand the logic of, if I'm being honest, you know, just as people are going to bed, to land another announcement on people that the number of people that will be allowed to gather will be reduced to 6. Now, again, not necessarily saying it's the wrong thing to do, but the manner in which these announcements are being made is adding to the public's confusion and anxiety. And I don't think we can carry on like this. There has to be a reset moment here in the way the government is making these announcements, because it's losing the public, and we can't afford to lose the public going in to such a challenging autumn and winter. So I would be calling for the reinstatement of the daily briefing, but not led by politicians, led by experts, scientists, medics, and that should be the place where changes are announced, so that the public get used to looking to that forum for any changes. And if changes are being announced, the experts then should take people through the evidence to support those changes. I think this is urgently needed. We have to win back public trust, boost public understanding of some of the difficult decisions that the government is having to make. And I hope it's a suggestion that everybody can support, because the way things are currently being done, as I say, is not helping. Turning to some of the specifics, particularly in relation to Bolton, in my view, this was an announcement, again, without all of the supporting information, and particularly the issue of financial support, a financial package to support people affected by this announcement, because there will be many people in Bolton who would have been going to work in pubs and restaurants last night, or people who would have driven people in taxis to and from those establishments, who are finding themselves with a massive hole in their income today. And the reason I'm raising this is obviously to speak up for those people and those businesses in Bolton, but also because there's a precedent here. If this is to be done elsewhere going forward, I don't think you can land this kind of announcement on people without also providing the support for people to cope with it. And yet we haven't seen an announcement of any financial package to support individuals and businesses in Bolton. And I think it's critical going forward that the government always announces those two things together, because it simply isn't fair to pull the rug from under people without them having any way of supporting themselves. It's too easy for the government just to put communities under lockdown without providing the necessary support. So Bolton have had some money to support enhanced test trace initiatives, but we haven't got a financial package here to support individuals and businesses. And I am certainly calling for one today, and actually will not want this moment to go without saying, if this is the way things are going to be done without a financial package, that sets a terrible precedent that will make it very, very hard for people to cope with what's being proposed. There was also a worry expressed today about one of the consequences of this announcement, whereby maybe closing pubs and restaurants in Bolton gives people there an incentive to travel outside of the borough, and that in some ways might encourage spread. Now, we're just raising the issue to say it is an issue and it needs to be watched. Of course, people in Bolton are asked not to gather, but nevertheless they could go with members of their own household to a pub, and I don't believe there's anything to stop that in a different borough. But it's an issue that does need to be watched, and is certainly one that was discussed this morning. What all leaders raised this morning were major concerns about the current management of the testing system and the way in which the public are being sent to the far-flung corners of the United Kingdom in search of tests. Now, this isn't acceptable anywhere, But in Greater Manchester right now, where of course we need that testing capacity available to us, it's just a critical issue that needs an urgent solution from the government. We can't wait weeks for a solution. Even in Bolton, we're being told that people aren't able to access a local testing appointment, which again isn't acceptable in the situation that we find ourselves. So we would urge the government to fix it first here and in the other places around the country where there's the highest incidence of cases, but of course we need a national solution to that issue. And it brings me to the final point that I just wanted to make before opening up to your questions. You know, we believe that a much better solution is needed to deal with all of the issues that I've been through today. You know, just putting communities under regulations or lockdown, it's too easy to do that, when actually a much more intelligent, targeted solution is needed. So Greater Manchester has been in positive discussions in recent days with the Health Secretary, with the head of NHS Test and Trace, about a proposal for a locally controlled test, trace and isolate system, and Greater Manchester becoming the first region in the country to take on that full responsibility. What we have done is we've worked up a proposal with support from the WHO's Special Envoy, Dr. David Nabarro, for a scheme that would place responsibility and accountability for the management of the system here in Greater Manchester. And it's very consistent with what the WHO have said throughout this crisis, that test, trace and isolate needs to be locally controlled. And what we have got now is an emerging proposal for that. We think it's going to get much more buy-in from the public if this is a more bottom-up approach, where we're working face-to-face with people in communities. We think that is going to get the level of engagement with test and trace that we need, which is currently lacking from the national approach to these issues. As we can tell, testing isn't working, but nor is contact tracing. And all leaders asked me again today to stress the crucial importance of financial support for people to self-isolate, because none of this will work if people are going to find themselves without money for the period that they will be off work. They need to have their wages covered, because if they don't get their wages fully covered, they risk going into debt and they won't be in a position to do it. So these issues have been raised long enough, and what we're saying to the government is work with us on this. The proposal is being sent into them later today. It's a strong proposal. It comes from a city region with a track record of public service delivery and innovation. Of course, we have a strong integrated system here, which we believe will make us the right place to do this. We urgently need a better solution than the one that we've got. The national test and trace system is not working for Greater Manchester, and we can't go much later into this year without a better approach and a system that works. We think we've got a proposal for it. We want to work in partnership with the government in bringing it through. The proposal's going in headline form today. There'll be a further period of work needed to put the detail behind it, but we very much hope that the government and NHS Test and Trace will work with us to put this system in place on the ground as quickly as possible. Thank you for listening, everybody. That's my initial comments done, and I will hand you over to Ross to go through your questions. Thank you.
Thanks very much. I'm going to take a question from Andy Bounds of the Financial Times to you, Andy. Do you think that the government's latest measures to limit the gatherings will have an impact in Greater Manchester boroughs where such restrictions already exist and across England?
Well, I certainly think that the measures are probably needed. I say probably, I think they are needed because the government is clearly looking at the evidence from across the country of the sharp increase in cases. And as I was saying at the start, Andy, I don't think the statistics yet are fully taking into account the impact of the return of schools. It is the case that the more people gather in greater numbers, the greater the opportunity for the virus to spread. And certainly in Bolton, we've heard how in particular setting, there has been a large amount of cases that can be linked to one incidence in a particular pub or group of pubs. So, getting this message over that gathering is what spreads this this virus, I think the government is right to do that. Where I have a concern is about the way it was again communicated late at night without the supporting information. Now, I know the Prime Minister is going to address the nation later today. I think he does need to provide that supporting information for people. But as we go into the most difficult phase of this, and I think we are entering the most difficult phase of this crisis, I think the government is right to act quickly, but it needs to carry the public with it. And that's why I say go back to a daily briefing led by experts, where the evidence underpinning these decisions can be clearly laid out for the public. And I think that will be the best way of getting the public to buy in. Just making announcements late at night without all of that supporting information isn't currently doing enough to win the public over. And I'm not saying this is the case, but it's suggested this morning in the media that there were some political considerations for putting such an announcement out so late at night. I don't know whether that's the case or not, but it doesn't build trust in the way this is being done. And urgently, we all have an interest in the government re-establishing trust in its announcements relating to COVID-19 restrictions.
Thanks, Andy. We're going to take two questions based on some of the comments you've just made. Chris G, 12 minutes past 2 from the Bolton News. He said that the situation in Bolton has in part been attributed to attendance at pubs and restaurants. Would you urge the naming of these establishments so people who visited them recently can take appropriate action? And alongside that, I'd like to take the question from Katie at That's Manchester. That's 9 minutes past 2. How can the government communicate the new restrictions to the public better, who often feel confused by changes at short notice? And she's particularly referring to the hospitality sector in Bolton, who were given new COVID rules with immediate effect yesterday.
Thanks, Ross. So, Chris, to turn to your question, I don't know. I hesitate before agreeing with you, because I think there are many pubs and restaurants who've done the right thing and have had an outbreak, and that's not necessarily their fault. And then they close and they deep clean, and rightly so. I think if we get into a crude naming and shaming approach, I think we could end up damaging businesses that have already been very, very damaged by this. It's different, if we've got establishments that are flouting the rules, then possibly. I was given figures today from the ACC, Nick Bailey, Greater Manchester Police, in terms of the visits carried out at establishments across Greater Manchester and some of the action taken. So I can assure you there's a huge amount of activity going on there. Putting those names into the public domain, well, I think repeat offenders, yes, I think there would be a case for that. But more broadly, those who just had to close because of an outbreak, well, I think that wouldn't necessarily be fair. I'm calling today, Chris, for support for businesses in Bolton. I just don't think it's right that they can be forced to close without a financial package in place to support both the businesses and the individuals who work for them. It's a massive omission as far as I'm concerned. And I think a better way for us all, the media in Bolton, myself, leader of the council and councils across all parties, would be to say, we need a package together, sort of get a message back to government to say we need a package of support for Bolton businesses and individuals. And what we mustn't do, I don't think, is turn against isolated and looking as though it's our businesses that are to blame for this. It's not necessarily. This is not particularly anyone's fault other than those who've been flouting the regulations, the individuals I'm talking about. But let's get a consistent message back here that businesses need support right now, particularly given the sudden nature of this this announcement. So that takes me to your question, Katie. I think the way they can better communicate is by going back to that daily briefing, as I said, but with experts leading it. And I just think they've got to get better with the timings here. So how can one announcement be with immediate effect And then later in the same day at 10:30, another announcement that it's going to come in on Monday. I personally, I can't myself see any logic for the different way of doing this. And I think when it comes to businesses, obviously you would think that some time might be needed to allow businesses to make some adjustments. The situation is urgent in Bolton, absolutely. But I do wonder about the timeframes that are being attached to these announcements, because they don't appear to follow any obvious logic. I think the decision was to close pubs. It needed to happen as quickly as possible, but more allowance made for the impact on those individual businesses possibly should have been made.
Thanks very much. I'm going to go to Nigel Barlow from out Manchester. I'm going to take one question, and then if we have time, I'll go back to the subsequent ones. Following your letter to the Health Secretary last week regarding GM's suggested strategy over containing the virus, which you spoke about, it's now been submitted. Is there any more info on this, and did you get an answer? I suppose actually your comments about submitting it might supersede that.
Well, last week, Nigel, I had a number of positive discussions with the Health Secretary. So I've always said in this crisis, I'll call it straight, credit where it's due. The Health Secretary's been open-minded about our proposal and encouraging in some ways. So I had a conversation with him. Myself and Sir Richard Lees had a conversation with the head of NHS Test and Trace. It's been positive. There has been a positive response to what we're saying. And obviously today, a more substantive proposal will go in quite broad brush strokes at this stage, but we're now going to then work on the underpinning detail, which is already underway, to be honest. So we're working at pace on this, and there's been a huge amount of effort going on this across Greater Manchester. So, we are moving quickly. We personally just feel strongly, and this is the view of all of the leaders, there's got to be a better solution than the one we've got at the moment. Test and trace isn't working, and then we get blanket restrictions or lockdowns. That is not a good combination at all. And we think if we're doing the targeted work better, demonstrably so, we will be in more of a position to say to the public, if restrictions are needed, that we've tried everything else before the restrictions. And we're not doing that at the moment. And that's got to be fixed. Do the preventative stuff first, rather than just hitting people with the slightly easier blanket restrictions. And this is a really important point for the Treasury to take on board. The government's making announcements about restrictions on communities without an accompanying financial package, which kind of suggests that central government just sees restrictions as the easy, low-cost way of dealing with this. But putting some of the poorest parts of the country under lockdown is going to cause massive damage going forward, and makes the whole notion of levelling up something that clearly is in risk of becoming in reverse. And what we're saying is, if the government was to put in place a financial package alongside restrictions, it probably would then start to think about the business case for investing in prevention rather than restrictions, and funding some of the test, trace and isolate work that forms part of our proposal. So, that's the argument that we're making. Start funding prevention rather than just placing people under restrictions, and also then without giving them any financial support. There's got to be a better way, and I have to say, encouraged by the government's response so far. If we can agree this proposal, I think it would set us up better for the remainder of this year and the winter, because at least we'd have got back to a stronger sense of local national unity between local government and national government.
Andy, there's just been a government announcement. We'll get a few questions in on that, just on what you've been talking about. Andy Bounds has said that the government has announced during this press conference that large businesses that have to close in places like Bolton will get up to £1,500 every £3 every 3 weeks, and small ones up to £1,000 every 3 weeks. He said you've obviously not been consulted. Do you think that this is enough? It probably equates to one busy weekend at a pub or a restaurant. And a similar point from Jen at the MEN, who asked, do you think this sounds sufficient for Bolton's purposes?
No, I don't, Andy and Jen. It's something, but it's definitely not enough to save some of the businesses that are now seriously at risk as a result of these regulations. So I'm surprised, actually, the figures that you're quoting. They seem, well, what do they seem? I mean, 1,500 every 3 weeks. Does that suggest it's £500 a week? I mean, I've not been able to engage, as you know, because this is something I've not heard about to this point. It doesn't sound enough to stop business failure or business collapse. Again, like the self-isolation scheme they announced, it's like a nod in the right direction, but nowhere near enough. And what I would also say is, it's not just about supporting businesses, as important as that is. It's the individuals they need to be thinking about. There are people who were going to go to work in pubs in Bolton last night and tonight, or drive taxis around Bolton, who now will have found that their income has gone. And what are they meant to do? I know Bolton Council has been arguing for a sort of rewind of furlough for people in that position, but that may not be available to everybody. There needs to be support put in place to stop real hardship in Bolton and other places like it that are subject to these kind of restrictions, and of course to stop business failure. But the figures you're quoting to me, which are news to me, I'm not sure are anywhere near enough to do that. One thing I should say, because you asked, Andy, whether I was consulted, I did, in a conversation with the head of NHS Test and Trace last night, say there had to be a financial package of support for individuals and businesses. So I had put that request in, but nobody had consulted me or informed me about any potential announcement.
Thanks, Andy. Hannah Granada asked, restrictions have been in place for parts of Greater Manchester for 6 weeks and the infection rate is still going up. Does that mean that the restrictions are failing? If so, why, and what should be done about it? We keep hearing about young people, adults, passing it on to older people. Has the age profile of cases increased at all over the past 6 weeks?
I don't think the restrictions are failing, Hannah, in that, when they were introduced, we did see a dampening effect on the rate of increase that we were experiencing in Greater Manchester at the time. So I think they had an impact, and a good one, in stopping the rate of increase. But what I think we have noticed is their effectiveness has diminished over time, and the longer that they've been in. And I think there has been clearly a concern about the younger age range not necessarily following the restrictions to the letter. So, when I mentioned the change we'd seen over the summer and the feeling that, obviously people being out and about over the summer having led to the increases that you've seen today, that is what people are saying. It's not just young people, which people maybe think of as teenagers. It's people in their 20s, 30s, and 40s that we think have been largely responsible for the change in the virus up to this point. The danger, of course, is that the age profile is starting to change again, and it's going towards the older end of the population. Hence the slide I showed on hospital admissions and care homes. I mean, that is where we get into a really, really dangerous position. And that's why I said, to the whole public of Greater Manchester, please look at those figures. Please think about what you're doing. Follow the guidelines. They're there for a very, very good reason.
Thanks, Andy. Just going to go to a question from Stephen Kingston at the Salford Star, just looking for clarification. He said, you seem to be implying earlier that more testing is equating to more cases. This would be the complete opposite of what Richard Leese was saying last week. Could you just clarify the point you were making?
I think, obviously, it's not controversial to say that the more you test, the more you might identify cases. But as Richard was saying last week, and this is where we agree, it's the positivity rate that's the issue. So what percentage of the tests that you are doing are revealing a positive diagnosis? And it varies across Greater Manchester, but the positivity rate has been increasing, and that's the figure I think that people are looking at most, which has increased, particularly in Bolton, but has also increased in some of our other boroughs this week. So that higher positivity rate is the issue. More testing doesn't necessarily mean, obviously you identify more cases, but it's the positivity rate that I think is the key figure that needs to be watched. We are proud that we are doing more testing. You know, if you look at when Leicester went into lockdown, they weren't doing as much testing, so probably their case numbers are higher. I think because we are doing more testing, we can have not so much that we identify more cases, but we got more accuracy, I think, in our figures, and that's something that is very important. But it's the positivity rate that we are increasingly watching to give us that information about the spread of the virus.
Richard, can you hear me okay?
Yeah, it's quiet, Ross, but yeah, we can.
So Richard at the Daily Mail asks, how would a localised shielding system work? Would it be along the same lines as the national scheme which operated during the lockdown, or would you propose anything different? If so, what would the difference be?
Thanks, Richard. So what we've been told today is that the more we now learn about this virus, the smaller the cohort of people who would need shielding probably would now be, because obviously we took a very cautious approach at the start of the crisis, but it's now clearer who are the most at risk from if they catch COVID, what people are therefore then most at risk. So it would be a smaller group. It would also mean obviously the support provided to that group more locally, working with voluntary organisations. The national shielding scheme and the national deliveries I don't think ever worked particularly well in terms of the food that was provided wasn't necessarily what people wanted. So what we're saying is, you know, consistent with our proposal for a locally controlled test, trace and isolate system, I think the time is also coming now for a locally controlled shielding system where, you know, we could identify from our local knowledge and the information held by other public agencies, the individuals in communities who are most at risk. And it might not just be a risk of the virus, of course, they may be at risk from a mental health point of view, or just from severe isolation, whatever it might be. And then we would be in a position to provide them with the most appropriate support, perhaps more individualised approach to the notion of shielding. So I think this is something that's going to be needed. And again, it need not cost the earth, but I think it will cost. So funding provided to local authorities and a clear instruction given to develop a local shielding programme. From my point of view, I'm looking at that anyway, whatever the government decides to do. I think given the figures that I've presented to you today around hospitalisation and the possible beginnings of a change in care homes, we're hoping that's not the case, but obviously we have to look out for that. You know, we think we will need some form of shielding programme, certainly in the winter. So, you know, that work is ongoing in Greater Manchester. Obviously, if we were to get national support, I think it would make it as a more enhanced offer than it might otherwise be able to be.
Thanks. Going to take two questions. First one from Gaynor Clark at the Wigan Post, 227. Are you concerned about the infection rates rising in Wigan, which has long had the lowest number of cases in GM? And Nick Statham asks, could Wigan and Stockport come back under local restrictions if they remain on amber alert over the coming weeks?
Yes, thanks, Gaynor. The infection rate is rising, but it's still relatively low. And don't forget, of course, the wider context for the figures that we presented today is that cases are rising all over the country. And I think Wigan is still very much closer to the national average than other Greater Manchester boroughs. But nevertheless, of course, we're concerned, and we were concerned back in the summer, and that's why Wigan was part of the restrictions that were announced to protect the borough from seeing the increases that other boroughs have experienced. The second question, Ross, was from who? Sorry.
So it was Nick Statham at the Manchester Evening News at 2:30.
Oh, sorry. Could they come back under? Well, I certainly hope not, Nick. As I was saying in answer to Hannah Miller's question, you know, we have doubts about how effective the restrictions are, but nevertheless, given where we are, obviously, we recognise that this isn't the moment to lift them in the other boroughs. I would say actually to people in Wigan and Stockport to minimise social gatherings in the home, because that would be the best way of the question not arising as to whether or not restrictions should be reimposed. But generally, we don't believe restrictions and lockdowns are going to get us through this. We need a much more intelligent, targeted approach to managing the spread of the virus in our communities, and that's the substance of the proposal that's gone in to the government today. So, we would say get on with that, and that is much more likely based on the evidence we have from Oldham, but also the evidence we see in Blackburn and Luton and Leicester. It's that highly localised, high-impact approach in communities that has been most successful in driving cases back down, much more so than any form of local restrictions.
A question from Joshie Herman at the Mill. Andy, you refer to a large, so it's 227. Andy, you refer to a large amount of underlying virus in communities across GM at the start. Can you tell us more about that? Does it mean that our increased testing is picking up a lot of the virus that was already there among young people, rather than identifying spread that's increasing at an alarming rate now? And Jen Williams also asks, on hospital admissions, it's a question just below it, you referred to a significant rise. Is it possible to say yet whether this is a trend, and are there some parts of GM that are seeing particularly high rises?
Thank you both. So Joshie, on your question, when I said about a large amount of underlying virus, it's related to that point I said about lockdown being lifted too early. I do believe, I said it at the time, I'm saying it again today, I think it was a London-centric approach that lifted lockdown in the first case, because I never was convinced that we'd got the numbers low enough here for lockdown to be safely lifted. And you'll remember that the R rate in the northwest went up to 1 shortly after that, and those points were made again at that time. So I think what we've had here is a situation where people were being encouraged back out again, eat out to help out, get down the pub and all of that, when we had a higher level of underlying level of virus in our communities than other parts of the country. And I wouldn't say it's the only answer to that, but I think it's part of our problem that we have today. When it comes to testing, this is the issue, isn't it, in terms of looking at the numbers of tests done, as I was explaining to the Salford Star a minute ago, and the positivity rate. So yes, we are doing more testing, and that might be now picking up cases that were there, levels of cases that were there, but perhaps not being picked up when the levels were lower. However, it's when you look at the numbers of tests alongside the positivity rate, and what we've seen in Greater Manchester in the last few days, last week or so, is an increase in the positivity rate, and that tells us that our number possibly is over 1, and that the virus is spreading and spreading more quickly. So it's looking at those two things together, Joshie, is the issue. We are right to be concerned about the current situation, and to be fair, so is the government, and we want to work with them on managing that. Jen, on hospital admissions, it is a significant rise, because obviously it's gone from 16 to 35 in the last week. If you look at the figures pretty much through August, they were fairly stable, really. They'd been coming down through May, June. Well, May was the peak, and then into June, and then they started to come down through July. But for the first time now, you can see a rise, and the 35 figure represents a cumulative figure for every day. So this is every day there's been a short rise. Is it a trend? It's probably too early to call that as a trend, if I'm answering your question as directly as I can, but you can't rule out that it might be the beginning of a trend. There is one particular hospital with a particular high number of cases, and that's a big part of the figures that we've got. So there is one hospital in particular that's seen quite a significant rise in people in hospital with COVID. So that might in many ways explain some of these figures, but overall we think there's a slight uptick here now in the number of daily admissions across GM, as well as having this particular issue in one of our hospitals.
Thanks. Just given the time, I'm going to try and take at least one question from everyone who's answered, so apologies if we don't get to everybody's follow-up questions. I'm going to take two together. So the first one's from Lizzie at Global at 2:25. What do you make of reports of a super spreader in Bolton who went on a night out instead of quarantining after his holiday? How can quarantining after going abroad be policed? And Aaron Benson, Roch Valley Radio, just above at 2:23. A rise in cases in many areas has been down to younger people not following government rules. However, having had been told throughout August to eat out to help out, do you understand the levels of anger and confusion amongst young people towards the government over the new rules and regulations?
I mean, I've certainly heard those reports, Lizzie. So this is apparently somebody who came home from a holiday and didn't quarantine and went on a pub crawl. I say I'm only giving you what I know, but I am told that it is linked to a large number of cases and a large part of the problem that we have in Bolton at the moment. And I think what it says is, one person here can change the figures for an entire borough, and a handful of people could be responsible for closing all the pubs in a borough, or indeed putting a borough under lockdown. And this is, I think, where we've got to really kind of focus now. This isn't, it won't happen to me, or I won't make any difference. You will. If you behave that irresponsibly, you could put a lot of people's jobs and businesses at risk. And that is where this is at right now. And I think the government are asking Greater Manchester Police to consider how a stronger enforcement approach can be taken to quarantine on the back of this case, possibly, and other cases around the country. What GMP are reporting today is that they are stretched to the limit. So the government is loading new jobs on the police force. Enforcing quarantine, the new rule around gatherings of 6, and I think there's just a real concern about where the policing capacity is to deal with all of this, alongside all of the other issues that they are also dealing with at the normal policing issues. Aaron, in response to your question, I absolutely understand the confusion, and I have expressed concerns about Eat Out to Help Out, as I did about the message that people were being strongly encouraged, if I can put it that way, to get back down to the pub. We've got to learn to live with COVID, and just telling people to get back out there doesn't do that. And I don't think we've ever properly had an explanation of how you live alongside this virus. I'm here in the office today, and I started by saying that I've made a point of coming back, but it's not the office as I know it. This is an office that has a fraction of the number of people in it at the moment. The layout has been changed. There's sanitizer everywhere. We look, rightly so. We've got to get over here that you just have to fundamentally change your life if you are to safely live alongside this virus. And I don't think that was present in the government's messaging in August. And I think we're reaping some of the consequences for that now.
Thanks, Andy. Kevin Fitzpatrick, Radio Manchester, asks, the chair of the Bolton NHS Foundation Trust, Professor Donna Hall, told Radio Manchester today that we basically need another full lockdown. What do you say to that? And why do you believe we're entering the most serious phase of the crisis? That's at 2:31.
Okay, so thanks, Kevin. I think though I agree with Donna on many things, that's premature at this stage to say that we need another full lockdown, because we're not trying everything possible better to manage and live alongside this virus. And it comes back to what I was saying about local test, trace and isolate. It's really important to add that last word in, isolate, because test and trace won't work unless people are supported to isolate. The WHO have been saying that all the way through, and I just don't think as a country we've been listening to them. Put it under local control, build it from the bottom up with the trust of communities, face-to-face, doorstep work. That's the way to do this, and we've not been doing it. So do that rather than just go straight back to another lockdown. Donna's right to say that if we don't do those things, then another full lockdown might be the only resort we've got left. But I hope it never comes to that. And actually, it'd be unforgivable, really, if the country went into a full lockdown without having fixed test, trace and isolate first. That was always going to be our first line of defence against the virus, and it's a pretty shaky line of defence as it stands at the moment, given the poor quality of the national testing system and the failure to give people local appointments, the tracing that isn't getting to the contacts of many people, and the lack of financial support to self-isolate. It's failing on every level at the moment, and that's what we need to do. Our focus needs to be on fixing that, and hence this proposal that's gone in from Greater Manchester today. And why do I say we're entering the most serious phase? Well, of course, the figures that we've posted today don't take into account the return of schools. So we can expect to see an impact as a result of that in next week's figures or the week after. Then we have to think about the return of universities. And again, what that will do, we have one of the largest student populations in Europe in Greater Manchester. Again, that will bring a new challenge that we have to deal with. Then we have the flu season and people potentially confusing flu symptoms with COVID symptoms and the pressure that might put on the NHS. But then we just have the winter and COVID and the normal winter pressures. So that's why I say this is the most serious phase of the crisis, Kevin. All of this being done without a treatment or a vaccine. I think, the Deputy Chief Medical Officer, Jonathan Van Tam, was absolutely right this week to issue his warning in the terms that he did. We've got to get our focus back here. Lives are at stake here as we go into the remainder of this year, and we've got to get our, going back to the previous question, the kind of climate that was created in the summer around Eat Out to Help Out and all of that. I think it has had the effect of taking us in the wrong direction.
Thanks, Andy. Given the time, I'm just going to ask the final two questions now. Apologies to those who didn't get to their follow-ups. Grace Marner at the Oldham Chronicle at 2:41 asks, you mentioned that the government needs to think about the people and not just the businesses. It seems the general consensus among the public, particularly in GM, where we've not been able to meet other households for a while, they'd much prefer to see their family than be able to go to pubs and restaurants. How can the government and local authorities motivate the public to continue to distance themselves when many are starting to struggle? And then Kevin Gopal for the Big Issue North at 2:46, with the ban on evictions for private renters only extended to the 20th of September, do you fear that an increase in homelessness has only been deferred, and are you pressing for a further extension?
Thank you. Thanks, Grace, first for your question. I certainly understand the feelings that people have. I mean, this comes back to the challenge we had when the restrictions were first introduced. The logic here is that public spaces like pubs and restaurants are regulated by the distancing and the rules that they have to operate under, whereas the home is not a regulated space. And when people gather in the home, the evidence would suggest that is where transmission is most likely to happen. Now, I understand how that creates real distress for families because of the inability to meet, but to be fair to the government, they are trying, I think, in this instance, to follow the guidance. One issue we did touch on today, which is the whole question of care home visits, and I know the inability to visit loved ones in care homes is causing massive distress to thousands of people in Greater Manchester, and there was a proposal being worked up to allow to agree a way of allowing care home visits before the restrictions landed, and that's been just put off, postponed as a result. But we want to get back to this issue of seeing if there's a way of allowing managed care home visits, even though, obviously care homes are very much in our focus at the moment. If it's done in the right way, we still think it can be done without posing a risk to residents or to those homes more generally. So, I understand the point that you're making, and very much we want to help people where we can. But obviously the way it's been done is because of the evidence about transmission in the home. The second question, Ross, was it Kevin Gopal, wasn't it? Yeah.
Yes, it was.
Well, Kevin, we had a meeting yesterday of the Greater Manchester Homelessness Programme Board, and it was generally said that the deadline of 20th of September is causing us a lot of concern. Although ministers have written round to local authorities, I think in the last week, where excluding cases of antisocial behaviour, I think, where they say a more urgent response might be needed, they are saying that a 6-month notice period would need to be given. So they've kind of pushed it to the end of the financial year, if you like, by setting out a longer process for eviction as opposed to a fast-track eviction. Now, I don't think that goes far enough, personally. I think the ban should be extended, given the extraordinarily difficult circumstances we are in. So while I'm pleased that there's been some movement from ministers, it's, again, not enough. And I would like to see the ban extended to the end of the financial year.
Fab, I think that's us out of time. So if you've got any final comments.
I don't think I do today, Ross. I think I've said everything that I wanted to say. Thank you, everyone, for your questions. I think the position that we're in is pretty clear, isn't it? It's a challenging position, and as ever, hope you will be able to pass on some of the messages I've given today to your readers. You know, it's very important that we've got your support in this, and just getting that clear information to people, and obviously the messages that I've given today. So thanks as ever to all of you. It's really great to see so many of you always join these press briefings, and your very considered, intelligent questions. We're grateful, and I hope some of what's been said might be useful to your listeners and readers. So thank you, Ross and the team for putting it on again, and we will see you all next week.